Hello, everybody. My name's Cristiane, and I'm a exercise physiologist with Simply Health Solutions. And today I wanted to talk about exercise and blood sugars and kind of their relationship to one another. This originally started because CSEP, so the Canadian Society for Exercise Physiology, posted an article about this exact topic, and it was on a research article that was published. And I wanted to share the findings with those who are struggling with their blood sugars and trying to figure out ways to manage their blood sugars in various different ways. So for today, I'm going to be talking about HIIT training and blood sugars. So first, I'm just going to talk a little bit about what diabetes is, a little bit of the overview, what is HIIT training, and then I'll share the research findings. So for those who don't know, diabetes is a condition of blood sugars, and there are basically three different types of diabetes. And all basically have challenges with maintaining their insulin levels, which in turn affect their blood sugar levels. So what is insulin? Insulin is a hormone that helps manage blood sugars. It allows sugars to enter cells for energy production and usage. I often think of it like a key to your home. So, this idea of without insulin, sugar is unable to enter into your muscles or unable to enter into your home. So, insulin is kind of like a key that helps your body to actually use the blood sugars that are in your system. Without insulin, what ends up happening is those blood sugars stay in your bloodstream, and if not treated, can actually wreak quite a bit of havoc on various parts of your body, whether it's your eyes, your fingers, your toes, other organs. It is a problem if your blood sugars are too high in your bloodstream for too long. So, type 1 is basically an autoimmune condition. It means that this person cannot produce insulin. Something has gone wrong with their pancreas, which is the organ that produces insulin, and they are just unable to actually produce it. So, they would have to take in insulin externally through an insulin pump or through another method. Type 2 is basically where there is a resistance to insulin due to just chronically levels of high insulin throughout that person's life or just kind of maybe in their recent history. For whatever reason, they have had very, very high insulin levels. And as with almost anything else in our bodies, if we have a chronically high level of something, our bodies will adjust so that it's not as overwhelming. So similar to when maybe you're in a room that has a very strong odor, whether good or bad, but after a while you kind of get used to it, you don't smell it as much. In a sense, that's kind of what happens with the insulin resistance is your body doesn't react the way it's supposed to because again, it's been bombarded with insulin for so long. There is a third type, which is known as gestational diabetes, tends to be a temporary form and often occurs during pregnancy. So for the sake of this presentation, we're talking about type 2 diabetes. So individuals who have developed a insulin resistance. So that's diabetes. Then you have HIIT training. HIIT training has been around for a very long time, and it stands for high intensity interval training. And it involves basically periods of high intensity exercise and then lower intensity exercise. Not super high and nothing, but it's higher and then lower. So this idea of you work really, really hard for whether it's a minute, 4 minutes, just kind of depends on how you want to do the program. But it's just that idea if you work really, really hard and then you allow your heart rate to kind of come down a little bit and up and down, up and down. Sometimes HIIT training can actually be a lot better and have a lot better results than just regular moderate intensity exercise. So, kind of that middle ground. Really depends on what you're looking at, duration of exercise. There's a couple of things to keep in mind. But overall, they actually have found HIIT training to be very helpful in a lot of different cases. So, when it comes to the research findings, what ended up happening is they looked at the question of what if we took individuals and did 10 1 minute high intensity intervals? Or what if we did 4 repetitions of 4 minute high intensity intervals? So it was just basically that idea of low volume or high volume hit training and how it would impact people's blood sugars. What they ended up doing was they got 14 older women with type 2 diabetes that did not currently take insulin and did this experiment and took a look at their insulin or their blood sugar levels. The exercise program basically caused or had the women either do the low volume or the high volume exercises. And one thing that they measured, or the way that they knew that the people were working at a higher intensity, is they took a look at their heart rate. And within the kind of exercise therapy world, we do think about this theoretical maximum of an individual's heart rate. And so they were basically taking these women to their heart rate, to 90% of their theoretical maximum. So not actual, but it's all based off of an equation that we often use, just to kind of have an idea of how hard these women were working. And then the blood sugars were measured up to 24 hours later to kind of see what would happen in their blood sugars. The results were rather interesting. Both low volume and high volume exercise lowered blood sugars for approximately an hour. So we didn't necessarily see a huge improvement, or in this case, decrease 24 hours later, but we did see an improvement an hour later. So this can be a good finding. And the other interesting part that they note is that those with higher blood sugars at the beginning actually showed more improvement than those that had lower blood sugars to begin with. So I often work with people where they say, it's not really worth it for me to exercise. I can only do 5 minutes, 10 minutes of exercise in a day because of whatever is going on in their lives. But we have often found in exercise therapy that actually that first little bit, let's say the first 20 minutes of exercise in a day, you actually get the most improvement. So in this case, the women that had the highest level of blood sugars actually had the biggest improvement. Now, that's not to say you should load up on sugars right before an exercise, but it is kind of exciting to see that exercise can actually help lower your blood sugars, even if you're starting off with a really high number. So, how can this actually help the average person who's dealing with type 2 diabetes? For those with type 2 diabetes, you can use exercise to help lower your blood sugars within 10 minutes. And that's the exciting part, is that you don't have to go out and exercise for 2 hours. You don't have to get fancy equipment. You don't have to go out and do all these fancy exercises, hire a personal trainer, go to an expensive gym. There's a lot of things you can do in your own home to get your heart rate up and to exercise and to lower your blood sugars. So for those who are looking for ways to exercise and looking for ways to help manage their blood sugars, this could be part of your blood sugar management plan. And do keep in mind whenever you are looking at managing your blood sugars, you do want to also make sure you're keeping your doctor and your pharmacist in the loop because they can help manage those blood sugars accordingly. If you'd like additional support and figuring out how to create an exercise plan and how to take into account whether your diabetes or other health concerns, feel free to contact me and we can always book a virtual appointment and discuss these things. I'm an exercise physiologist and I often help people with various different medical conditions. So whether it's diabetes, arthritis, low back pain, if you want to work on falls prevention or just improve your independence and improve your overall fitness, feel free to contact me, and we can always discuss these further. If you do have any questions, feel free to contact me and email me, and we again can kind of discuss things further. I do post my slides online, and I do record my lectures and do post them on my YouTube channel. So feel free to check that out as well. As I always try to tell people, make sure you are staying active. It's going to look different for each individual person, but feel free to go out and be active, and you'd be surprised what your body can achieve. And I've worked in the exercise therapy space for a number of years, and I've always had quite a few clients really surprise me and really achieve so much with persistence and consistency. Thank you all for joining, and I hope you have a great day. Bye.